important clinical practice in dealing with case of constipation. At the end of this presentation, we will be familiar with constipation, infant and toddler. Is it really constipation or not? This is very important. Some important terminology related to constipation: voluntary withholding, encopresis, dyschezia, functional constipation, which is the core part. مش باين كده؟ Okay. كده كويس. طيب كده احسن، بس اي موفمنت هيعمل لنا خرفشه. طيب ماشي. Functional constipation, which will be the core of what we are going to discuss, and the 9 famous questions which were mentioned by the Esbegen and Nesbegen, and the most important answers to be given, and accordingly the guidelines of 2014 was built. The resources of my presentation, I always start with my references and my resources. The resources is the website of the Nesbegen and the application, and which was an excellent presentation during the American Academy of Pediatrics in October 2020. This presentation was given about the scoop on poop, which means the details of constipation in infants. And here are the other resources. They are ready for me as PDF if any one of you wants to keep a copy of them. So I will give you example of some cases, and I need to know what is the link between each case I'm going to mention and the other cases. First one, a 1-year-old girl with hard-pulled like stools. 4-year-old girl with frequent complaints of dysuria and hard stools. 7-year-old boy with a weakly stool that is large enough to clog a toilet. And 11-year-old boy with daily fecal staining his pants. All of you know Elvis Presley. You know Elvis Presley, right? Who's Elvis Presley? The king of rock and roll. ده كان بيطلع ببدلة كلها ألماظ. Elvis Presley, when he died in 1977, it was a catastrophic event. Maybe 2 girls committed suicide after his death. What is the story of Elvis Presley? Elvis Presley كان بيغير ملابسه كاملة أثناء الحفلات because of soiling. لما مات عملوا investigation with his doctor to know what's the reason for his death. He had what is called a severe form or paralysis of the bowel. For 4 months he did not pass any stool. They forced him to receive catharetics, and he had the choice of continuous use of catharetics or colostomy at this time. And he refused colostomy and continued the catharetics, irregularity of his electrolytes, and arrhythmias and death. So the reason of the death of Elvis Presley, the king of rock and roll, is constipation. The term constipation, which denotes both a symptom and a chronic condition, refers to the infrequent elimination of large or hard stools that may cause pain or on defecation. More than 90% of childhood constipation is idiopathic or functional, and alhamdulillah, more than 90% of them will be cured. Now, the most important question I ask myself several times whenever a mother comes with a baby complaining of constipation. Is it really constipation or not? It's very important to have detailed a history from the parents. We have what is called poop milestones, like motor milestones, like mental milestones. We have poop milestones. Infants normally have up to 7 motions per day, or even more. Breastfed infants may go up to 2 weeks between bowel movements. Frequency usually decrease between 2 to 3 months, which is called transient constipation, physiological constipation. رجع الصوت تاني. Toddlers 1 to 2 motions per day, and for children above 4 years of age, it is 3 motions per day, up to 3 motions per week. These are the different colors. According to the color of stool, I can recognize what does this baby is complaining of. Maybe the most important color I'm interested to show it to you is the green color. The green color denotes cow milk allergy, fever, and common cold. Here are some data which may help you to, if the mother is asking you, my baby is gaining enough weight but not pooping enough. What do you think the complaint of this baby? I think it is some sort of dehydration. He needs more water. This is the only case in which we are allowed to give the mother some water between feeds. If the baby is not gaining enough and not pooping enough, this baby is not receiving enough milk. I think he needs a proper consultation for the way of nutrition. And if the baby is not gaining enough but pooping a lot, جايبه منين ده؟ يبقى ده some sort of intolerance. Our famous Bristol stool chart. I think all of us have to keep a copy of this chart in our clinics, because many times while I'm taking my lunch and I have a message from the mother, look, ya doctora, look at the diaper of my son. He has this form of diarrhea. مش شغال ده، مش كده؟ انتوا عاوزينه ده؟ بيفصل كل شوية. سامعني؟ مش مشكلة، أسيبه طيب يعني؟ ها؟ أكمل كده بصوتي العادي؟ ماشي الحال. طب خليه لما حطيته. Okay. يعني it's better to keep this one in your clinic so you can show them to the mother the poop of your baby is with which type of stool sample. Don't underestimate the importance of proper toilet training, please. It is an art. Dr. Ahmed Abul Hassan, rahmatullahi alayh, he was in Abu Rish, and he told me one day, it is not good to give your baby money. The best thing you can offer your baby is to help him and educate him to go to the toilet every day after breakfast. He has to go to the toilet every day after breakfast, better than giving him money in his bank account. So, implemented after 2 to 3 years of age, the mother who is trying to keep her baby continent after 1 year, she's just prolonging the period of educating her baby how to control his bowel. Encouraged to sit on the toilet for 5 to 10 minutes and 3 to 4 times per day immediately after major meals. If you have a baby who is insisting to pass a stool inside his diaper, what is your recommendation to his mother? What do you tell the mother? Remove the diaper? Huh? What you say? No. Continue to pass in the diaper, but inside the bathroom. Okay? This is an art, how to deal with the baby. He is afraid. If you remove his diaper, he's afraid. Okay. But there is a place for this. It is a bathroom. After that, he will accept to remove the diaper. Advice to maintain stool diary and records, and positive reinforcement should be rewarded, so the mother is clapping, singing, kissing her baby, hugging, everything when he is passing stool inside the toilet. By the way, this one, its name is Stool. It's by accident على فكرة. Any chair without من غير ظهر كده كرسي بيسموه stool. Why? If he's going to sit on the toilet and he's keeping his legs like that, not hanging, this will help him to force stool out with gravity. زي التويلتس البلدي. It is the best for treatment of constipation. So, breastfed and over 1 month of age, stools every 4 to 7 days that are soft, large, and pain-free can be normal. Caution, before 1 month old, not stooling enough can mean not getting enough breast milk. Straining in babies, if it is less than 10 minutes, it's okay. If straining of baby, less than 10 minutes, it's okay. Large stool size related to the amount of food eaten. Large eaters have large stools. Hard or dry stool, if it is passing without pain, it's okay. It's not constipation. And do not misinterpret other signs. Parents are obsessed with the poops of their babies. My baby did not pass a stool for the last 24 hours, ya doctora, what can I do? It is 3 days, ya doctora, what can I do? It's okay. It's okay. It's very normal. They are receiving milk, not a full food. Babies go through a period of learning and relaxation. It is some sort of a training. This is training is completely normal because he is training himself. Not every cry from a baby who did not poop for a few days means the mother has anal or rectal stimulation and has to give him any treatment for constipation. So be careful of the tone of the crying of the baby. Not every cry from the baby is considered, in a constipated baby, is considered something abnormal who needs interference. And I will show you some samples of what is called decoding of the crying of the baby. The pattern of cry of the baby differs, and it can help in differentiating different types of emotions in the baby. For example, nah. Do you know what does this baby mean? If it starts with nah, huh? Listen to n at the beginning. N means he is dehydrated and his tongue is touching the roof of the mouth. Hungry. This baby is hungry. Okay? This baby, not na, This means the baby needs somebody to burp him. He needs to be burped. If he had the same noises and he is constipated, I'm sure 100% the mother will insert something to relieve the constipation. And all he needs is just to be burped. Another cry. This means I'm not happy. I don't feel comfortable. And this is for constipation. This is from a study of a doctor. Her name is Dustin, who studied for many years how to decode the crying of a baby. It is prolonged irra, exactly the same way. So not every crying from the baby means he has abdominal pain or I have to interfere. So Some simple interaction the mother can do if the baby is really having some constipation is abdominal massage, clockwise around the umbilicus. Another one is the well-known by all of us, the pedalic movement of the baby, of his legs, and having a warm bath together with this movement of flexing the trunk. Also, the only situation in which it is we are encouraging juices to be given early to the baby, two types of juices, عصير البرقوق أو عصير التفاح, and nothing else please, and with no added sugar. Changing formula, usually changing formula, regular formula, will not help a lot in constipation, and it is proved that iron in the formula does not cause constipation. Rectal stimulation is okay if it is only for a short period, but it will not be a habit. Whenever the baby is constipated for a few days, I have to do some rectal stimulation because this will interfere with the normal learning of defecation maneuver. So, now we know that this baby has constipation with all the signs of constipation, passing hard pellet and everything. What is the expected age? At 6 months, because this is introduction of solids. At 3 years of age, because of the initiation. 3 years يا جماعة toilet training. 3 years, please. Remember this number. Because the mothers like to start very early. And this is the cause of constipation. Or we can start at 5 years because of start of school. The prevalence, أنا أفتكرش إن في حد يهمه قوي إن هو يعرف إنه عنده constipation في العالم شكله إيه وأنا مال. أنا مهم عندي في بلدي أنا وأسبابه إيه؟ هو دي اللي تهمني. أعرف فرق بين الولاد والبنات؟ لا مفيش فرق، لكن السايلينج فيه فرق. طبعا البنات مضاف. السايلينج في الأولاد. في predisposing factor طبعا في predisposing factor, high milk diet, low fiber diet, low fluid intake, lack of exercise, slow passage of food through the intestine, poor diet and eating habits, faulty toilet training, poor toilet habits. يلا يا ابني يلا خلص، باباك عايز يدخل، باباك عايز يروح المدرسة، باص المدرسة، كل ده بيخلي البيبي in a hurry and this cause constipation. withholding behavior and irregular therapy. بعد الأم ما بتحسن البيبي، والله يا دكتورة الله يعطيك العافية البيبي بقى كده. عملتي إيه؟ وقفت العلاج. وقفت العلاج ليه؟ وقفت العلاج ليه؟ بتعاقبيه؟ يعني خلاص اتحسن، والله لا أنا موقفة. one of the hugest mistakes from the mother is stopping treatment before informing the doctor. Very important to take history. Birth history, gestational age, preterms are more prone for constipation than full term. Introduction of cow's milk also is a very important cause for constipation, whether the baby has allergy or not. And transition to child care, روح الحضانة وما شابه. Family history is reviewed for evidence of genetic factors, whether it is a cause of constipation running in a family. It is not important that the mother is coming with constipation, she's telling you, my son has constipation. No. Most of the time they are giving vague symptoms. For example, the baby has nausea, has vomiting, has reflux, flatulence, anorexia, extended toilet time, large stool. Maybe, wallahi, large stool, maybe 50% of the mother have this complaint. Hematochezia, anal fissures, rectal prolapse, stool withholding. And when you examine the baby, please don't forget to examine his back. You will find a bunch of hair, you will find a pilonidal sinus, you will find something abnormal in his back. Please, whenever you have any baby with constipation, don't forget to examine the back. By the way, maybe 3 days ago, I have seen a patient with pilonidal sinus in a girl who is incontinent. She has encopresis, and I referred her to neurosurgery. She has pilonidal sinus with abnormality in innervation of the rectum. This is a differential diagnosis, huge differential diagnosis for organic causes. And at the end, 95% of cases is due to functional, idiopathic. Now, the voluntary withholding behavior, being afraid to pass stool. Suppressing defecation in an old infant, he learns how to stop the defecation. Maybe he's outside with his mother in a mall or something, and the toilets are dirty. I don't want to go. It's very dirty. So he will hold stool. Another situation in which there is pain during defecation, which is the reason for this withholding. Causes of voluntary withholding: anal fissure, perianal irritation, sexual abuse, hemorrhoids. Maybe intentionally the baby has the environment is not suitable for him. في المدرسة مثلا، المدارس مشهور قوي ان سبب الامساك في العيال المدارس اللي مش نظيفة. Emotional disturbance, severe mental retardation or depression. ده منظر الاثنين، يعني كل واحد فينا على الواتساب بتاعته صور للعيال الكونستيبيتد، الامهات مصوراهم فيديو لانهم عندهم حاجه اسمها epilepsy like movements. صوره يعني المنظر اللي شفته حاله واحده بهذا الشكل والله ما هتنسوها طول عمركم، حاله فظيعه بتبقى. ممكن تبقى على هيئه ايه؟ squatting, crossing ankles, stiffing of the body, holding onto furniture، بيروح في اي مكان ويفضل ماسك فيه علشان يمنع نفسه انه يباص الستول. ممكن يكون flushing وسويتنج، عشان كده بيعملوا له differential diagnosis of epilepsy. وممكن hiding during defecation، تقول لي بيروح ورا العفش عشان يعمل defecation في البامبر، بس بيروح ورا العفش كانه بيعمل حاجه عيب يعني فظيعه. الانكوبريسيس is involuntary soiling. Encopresis refer to the passage of feces into inappropriate places after a chronological age of 4 years. He is continent. Why he is passing stools? كان في عندي والله أستاذة في الجامعة كانت تقول لي أول ما أعمل أي ميتنج يكون في ناس محترمة عندي في البيت، ابني بيجي يعمل ستول في الصالون. He's sending her a message. For sure, she's sending her a message. You are neglecting me. Sometimes this is the reason for a psychological condition, reason for encopresis. We have two types of encopresis, retentive and non-retentive. Retentive means constipated وفاضل كيل، يعني الريتنشن with overflow فاضل كيل لدرجة انه الباور بتاعة الانترنال سفنكتر وأوفركم الباور بتاعة الانترنال سفنكتر والستول نزلت من نفسها. أو النون ريتنتيف، نون ريتنتيف انه ما فيش ستول ولا اي حاجه، بس الطفل عنده مشكله نفسيه، مشكله لوكال على الجي اي تي او كده وبيباص الستول. طبعا ده مصيبه، اللي نون ريتنتيف وبيباص ستول ده عايز قصه ثانيه خالص. احنا بنتكلم على اللي اغلبهم اللي هو ريتنشن ويز اوفر فلو، اللي هي بتوع الناس ويز فانكشنال كونستيبيشن. انكوبريس فيرلي كومن، بس اغلب الناس ما بتقدرش تعترف بيه عشان حاجه تكسف طبعا، ده حتى مع الدكاتره والله ما بيردوش يقولوا لنا، غير بقى يعني لما تطلع الولد بره وكل الناس بره وتقول لي في ودني يعني. It is estimated that anywhere from 1.5% to 10% of children have encopresis. It is more common in boys than girls. لا تعليق. Types. احنا في عندنا نوعين، primary and secondary. البرايمري منه انه عمره ما مسك نفسه في الستول، والنوع السكندري انه مسك نفسه فتره وبعد كده هو deteriorated. Many causes of encopresis. يعني there's no time to discuss them. And here is the retention with overflow. Retention إلى درجة إنه الريكتم بقى huge inside. He lost the sense of the desire to defecate, and this is the most dangerous part of constipation. من كتر الhuge enlargement of the rectum بقى الواحد مش يعني، هي دي المصيبة، إنه مش قادر يحس تاني بالريكتم. مش كده وبس، ابتدى يبقى ستريتشد لفوق، فخلى الانترنال سفنكتر بقى ستريتشد. يعني الانترنال سفنكتر هو الأهم على فكرة في اللي هولد الستول. لما ده يبقى ضعيف خلاص يبقى الطفل بقى كده بقى incontinent. ايه بقى الانفانت ديسكيزيا ده؟ انفانت ديسكيزيا عبارة عن baby straining for 10 minutes without a reason. And defecating or pooping involves the coordination of two opposing forces. Force from the abdominal muscles trying to push, and from the pelvic muscles to relax. These opposing forces sometimes are not well developed. This is the reason for dyschezia, and this is one of the classification now entered in Rome 3 and Rome 4 criteria. What is the treatment? Just reassurance. يعني نطبطب كده على الأم واستني وهيتحسن الموضوع وكل حاجة ومش لازم يعدي ستول. يمكن فروم 4 مختلف عن روم 3 إنه فروم 4 بعد ما كانوا بيقولوا إنها أول 6 شهور من العمر دلوقتي أول 9 شهور من العمر. Here is a dyschezia. Okay. Now to the core of our lecture. These are the guidelines which we are following now, not all over the world. This is from a famous USA lecture in American Academy of Pediatrics. Evaluation and treatment of functional constipation in infants and children. This is now the Bible for all people who are dealing with constipation. Their algorithm is very important now to define the way, how we will go. If the baby has this response, what I will do. If he's not responding, what I will do. Our way to treat patients with constipation is this study, which was published in the year 2014. Who was responsible for this study is GRADE. You know what's GRADE? GRADE is grading, recommendation, assessment, development, والحرف الأخرانية and إيه؟ and evaluation. هي عبارة عن إيه؟ عبارة عن ويب سايت موجود بياخد كل الداتا اللي أنا بديها له. أنا عايزة أعرف العلاج الفلاني كويس ولا لا، العلاج العلاني احسن من العلاج الترتاني، يتضافوا لبعض ولا لا، اعتمد على الاعراض ديت في المرض الفلاني علشان ابيلد a trustable guidelines for many diseases. ده عن طريق جريد. هي استعملت الداتا اللي جايباها من الكوكرين، اللي جايباها من الميدلاين، جايباها من many parts، جمعت كل الداتا اديتها لجريد، وجريد قسم الايفيدنس ديت الى 3 انواع، يا اما الايفيدنس هاي ايفيدنس او مودريت او لو، واكوردنج لها قرر يعمل الريكومنديشن. الريكومنديشن دي ممكن تكون ايه؟ ممكن تكون اني انا هايلي ريكومند ده، او اني انا اي دونت ريكومند. بيعتمد على الاستاديز وبس؟ نيفر. تعتمد على